On behalf of my co-authors, thank you for the opportunity to discuss our poster, Neandertal Introgressions contribute to upper Aero Digestive Tract Tumor survival and identify patients who may benefit from STING agonist treatment. Here are my disclosures. Approximately 85,000 years ago, Homo sapiens migrating out of Africa were confronted with new challenges, including novel foods, pathogens, and climates. They also encountered other humans, and the interbreeding of human species contributed to our modern gene pool. STING1, the stimulator of interferon genes, and toll-like receptors were potential targets of adaptive introgression. These adaptations reflect mechanisms of defense against pathogens, but their consequences to cancer biology and treatment are largely unknown. We investigated a series of functional interactions between archaic and ancestral STING1 and TLR alleles in order to identify settings in which patient outcomes could be potentially improved using STING agonist therapy. In initial analysis, we observed that the STING variant 7447927, or 744 for short, corresponded to a synonymous Valin polymorphism and residue 48, was in linkage disequilibrium with the reference allele of the most common STING variants. As a consequence of that, 744 homozygosity can be used as a marker of the STING wild-type haplotype. Based on the known biology of STING, we will expect wild-type STING to be pro-inflammatory relative to its variant forms. 744 was associated with the presence of Neandertal alleles and was distributed in a pattern complementary to the Neandertal-like TLR10 I775V. One potential explanation for this observation is that 744 and TLR10 I775V play similar functions. We then investigated the effect of STING and TLR variants on patient prognosis using data from approximately 10,000 patients in 32 TCGA studies. STING and TLR variants did not appear to have an independent prognostic value. However, in the subset of upper Aero Digestive Tract Tumor patients, the zygosity of STING and TLR variants was a predictor of survival in an epistatic manner. That is, the effect of the STING variant was contingent upon the status of the TLR variants and vice versa. Median survival times for patients with reference heterozygous and homozygous 744 status were respectively 1.8, 2.7, and 4.8 years. Based on these findings, we formulated the hypothesis the upper Aero Digestive Tract Tumor patients lacking homozygous STING 744 and pro-inflammatory TLR6 and TLR10 variants could represent an unmet medical need and might benefit from pharmacological STING activation. In parallel to these genomic studies, a first-in-human phase 1 dose escalation study of the STING agonist E7766 given by intra-tumoral injection was being conducted. Patient 1 was a 75-year-old white male with esophageal adenocarcinoma, history of GERD and Barrett esophagus, who was progressing from anti-PD-1 and chemotherapy at the study entry. The patient was heterozygous for 744 and have reference status for TLR6 S249P and received 1175 microgram intratumoral injections of E7766. This patient experienced non-treatment related grade 2 anemia and hyponatremia, and major inductions of interferon and IP10 were observed. Slides 9 to 11 show signs of clinical benefit with E7766, both at injected and not injected lesions. Progression-free survival was over 6 months. In conclusion, our results suggest that single nucleotide variants of STING1 and the TLR6 S249 gene cluster may improve our understanding of the prognosis of upper Aero Digestive Tract Tumor patients and provide opportunities for therapeutic intervention. A phase 1 dose escalation study of E7766 is ongoing, and additional studies are being planned to investigate its activity in this patient population. We thank the patients, study teams, and collaborators for their contributions to this research.